it's on. So this is how an expert does it. Alright, there's your syringe. Yeah,
First, of course, you wash your hands very well.
Yeah, you wash your hands very well. Alright. We're talking to a nurse here who's, you know, handled many pricks. Right, so that's the testosterone injection. She's going to open that up, but first she's going to put a needle on it, which is a size. I think don't you have to put the 22 on there?
18 to begin with.
Oh,
18's the big one.
Hell, I think I might have mixed them up. Because look, this one's got the pink on it.
That's your big needle.
Oh, hell.
That's why it took you so long to get it out.
Oh. See, that's what happens. You're either an expert or you're not, so I'm learning.
You would think that the larger number is the larger needle, but it's not.
Alright.
So you want to start with the 18 gauge needle.
18 gauge needle. Alright, so I've got to change needles again. Alright, so we're opening up the packet of the testosterone here. Mine took me at least 12 minutes to work this out. Does it need rubbing to warm it up?
Showing. It's sealed.
Sealed. Hang on, there it is. It's got a seal. So you rub it, and you rub it till it warms up, gets rid of the crystals in there. So I read, so I've already messed up and doing my injection, so I'm going to probably remove that video of my mess. No, actually it will be good to show people how I messed up versus how it's supposed to be done. Alright, so it warms up in the hands. Her hands are cold. She's got always a cold-blooded nurse. Alright.
I've rubbed many vials between my fingers.
Yeah, you can tell. Look at that, it's getting faster. That's called vials. Alright, so you click the lid off. Alright.
You have a sterile top.
Alright, you've got a sterile top. See that grey point?
Don't touch it.
No, see that grey point there? That's sterile, or sterile.
So if you touch it, then you're going to have to clean it with alcohol.
Yeah, and this is what I used before because I touched it. I used this alcohol. I don't know if you can see it, yeah. Alright, so you pull the needle out.
See what a huge needle that is.
It's a big needle, you can see it. Well, I used the wrong needle, I used the small needle. I thought the bigger the better, but it's not always the case. So you poke a hole in the end, turn it upside down, and then you pull the needle back to the bottom part of the bottle. At the bottom here, you can see her pulling back on the plunger. Here, taking in all the syrup, or whatever you call it, oil, which is testosterone oil, whatever that does. It has to go into the cheeks of my bum or bottom. Now look at that. My one took that darn long because I messed up. I've got to go and get another needle for her. Is that right?
Yeah.
To change on the other one.
You need the 22.
Yeah. Tell them what you're doing.
So now we have it pulled up into the syringe. I'll remove, I flicked the little air bubbles to the top here and got rid of those. So now you just have 1 cc or 1 milliliter of
that's the wrong one.
testosterone. I'm going to, until he's ready for me to inject this,
and take that off. You have to take off that.
I will recap the needle very carefully.
Show where it went wrong with the other.
Once you use this needle and you give your injection, you don't want to recap like that. I usually, if it were not my husband, nowadays they have needles that will retract back into the syringe, so they're safe. This one doesn't do that though. But once I give him his injection, usually what I would do, if it, like I said, if it were not my husband, I didn't know this person, I would lay the cap down on the table and then I would scoop it back up onto the needle without touching the cap. That way you don't have to be worried about sticking your finger.
Well, there's the new one, the 22 gauge.
So now that we have the testosterone pulled up into the syringe, we're going to take the big needle off, the 22 gauge, and we're going to put on the small needle.
Pull it together so I can see you twist it off.
Alright, so what we're going to do, pull it back a little bit. You're just going to twist the old needle off, the big needle. I got it on there tight. So you can see, twist it. There we go. What we'll do is we'll take. Bet you worked up the sweat pulling that stuff.
I was in there and it took like 7 minutes and a bit. I even recorded it. And I'm wondering, why is this taking forever? I thought, I'll show you what an expert does, and you were right.
You thought being a nurse was hard work, didn't you, after you did that?
Yeah.
So now we have our thin needle, our small needle on there to give the injection. But I've got a little bit of air down at the top of this because I pulled back the serum out of the other needle back into here, so I want to get rid of that before I give the injection. And what I do is just push that up a little bit till you see a little tiny drop out the end of the needle. You won't be able to see it in that. I don't want to take the cover off of the needle until I'm ready to do the injection. There we go.
Alright, so this one here needs to be changed over to the 22 because that's the one that I messed up on.
I'm going to pull that needle, I'm going to pull the plunger back just a little bit. So if there's any of the injection up into the needle, we're going to pull it back down into there so that we're not wasting any of that.
Any of the syrup.
Yep. So then we just twist this off. Well, I don't know which way to hold my hand.
Oh, it doesn't matter.
Twist.
When it comes off, it comes off. There, there's the new one.
New one. Good and tight. You can see there's a little bubble here, so we'll get that little air bubble out, and we'll have our needle.
Is it true that an air bubble can kill you in this situation, or is it just that it will make it uncomfortable?
That little air bubble is not going to be enough to kill anything. No, but you don't want to put that air bubble in there, but no.
So that's how you do those injections. Otherwise,
now we have 2 injections.
Ready to go.
One for each hip.
Because there's a few strange people on the internet, let's not show them you're injecting it into my butt.
No,
cheeks.
I don't think we'll show your butt.
Yeah, well, but I can show them the exact part where it could go into the butt if you pinpoint it when I move this up.
Alright.
Alright. Move your face so you don't get seen on TV. You might standing there. So, there'd be my butt cheek right here.
Okay. So what you do is you're going to put it like in the upper outer quadrant of the butt here on this big muscle that's here. You're not going to go down here and put it in the actual butt cheek. You're putting it up here in the muscle. So to go up in this area.
Right. That's it. And that's how you do the injections. That's actually talking to an expert. I thought that I had learnt something, but we're going to teach you another again in our next series how to do another injection for vitamin B12. This is the testosterone injections, showing out what a nurse does, why they're experienced and why I'm not, even though I think I was experienced. We'll stop this.